Hi guys, I'm Dr. Parissis and welcome to another video. Some of you may know that about 8 months ago, I started taking oral minoxidil to slow down my hair loss. A lot of you guys were wondering why I would even need to slow down my hair loss with the amount of hair that I had at the time, but I did actually have a hair transplant, and that was because I was a Norwood 3 on the Norwood classification scale, meaning I'd lost quite a lot of hair for my age. So whilst I was able to fill in the areas that I had lost with a hair transplant, the rest of my hair does need to be protected with medications. So some of you may have seen some of the videos that I made about my side effects from oral minoxidil, and there was one main side effect that made me stop oral minoxidil for good. That side effect was a facial rash. So I had taken oral minoxidil for 3 months for hair loss. I had developed this facial rash, and the cause of the facial rash was not clear at the time. There was a worrying study at the time of a patient who developed a similar red facial rash and developed a very serious skin condition afterwards called Stevens-Johnson syndrome. So I stopped taking oral minoxidil, and I want to tell you what has happened since. Interestingly, I did actually get quite a few people reaching out to me saying they had a similar facial rash from taking oral minoxidil. And here are some of the examples of that. So as a doctor myself, I hung up my doctor's hat and became a patient. I went to my own doctor and received a blood test for autoimmune antibodies, specifically ones like ANA, ANCA, as well as others. All of these were negative, ruling out the possibility that the facial rash was caused by an autoimmune disease. I was then able to see 2 consultant dermatologists here in the UK who diagnosed my facial rash as acne rosacea. Acne rosacea is a skin condition characterized by redness and small dilated blood vessels in certain areas of the skin. But it is different to traditional teenage acne and is much more long-term. It kind of continues throughout life. So what happened next? Well, I was prescribed a topical cream to apply to the facial rash called ivermectin cream. And I was also prescribed an oral antibiotic called limacycline. I took both of these medications for 3 months, and my acne rosacea dramatically improved. Once it improved, I actually thought I would try topical minoxidil again. Topical minoxidil is something I had tried many years ago, but I thought I'd give it another go with topical tretinoin, as there is some research to show that with topical tretinoin, minoxidil or topical minoxidil can be more effective. And I got a facial rash reoccurrence. I actually got the facial rash starting to develop again. So I stopped topical minoxidil as well. So what are my conclusions from this oral minoxidil experience? Well, the first thing is that I am likely allergic to minoxidil, whether that's oral or topical, and therefore cannot take it. My second conclusion is that oral minoxidil may trigger acne rosacea in a small number of patients who take it, as evidenced by myself and the handful of men that reached out to me describing a similar experience. In these patients, it is recommended to stop the minoxidil for good. So am I against minoxidil altogether? Well, absolutely not. There is very little research to show that minoxidil actually causes a facial rash or acne rosacea. And based on my clinical experience as a doctor now, viewing my own patients, there are thousands of patients that are taking minoxidil, oral and topical, without any facial rash. I would also argue that the 2 consultant dermatologists, the skin specialists, had never seen this reaction with minoxidil before either, and they were routinely prescribing minoxidil for their own hair loss patients. So I do believe that I am a unique case, and that a lot of patients can take oral minoxidil or topical minoxidil without any issues. I therefore still believe that minoxidil can be a safe and effective solution to combat hair loss.